Bismillahirrahmanirrahim. We are looking at some fetus mother relation or in important terminologies which are used in the OBS or during the labor. So the fetal presentation, fetal position, fetal lie, fetal attitude, what is fetal station. So these are some important questions. So you must need to know. So what is fetal presentation? Fetal presentation is it's actually show the lowest part of the fetus which is present at the mother pelvic outlet during the labor. So the what is which body part is coming out of the birth canal. So if it's a head, it's a cephalic. If the buttock is coming out, that is the breech. So if it's a shoulder, it's a transverse. If more than one anatomical parts are coming out, that is going to be the compound. So you can see here is the what is coming out head. So it's a cephalic. So if a buttock is coming out, that is the breech. If the shoulder, if it's called the transverse presentation. Okay. So what is the fetal position? It's actually show the position of presenting part of the fetus at the mother pelvis outlet. So for example, the head is coming out. What is the position of the head? Okay, so there are almost eight the position we commonly use for the fetal position. So, but four are most important. So, if you look at the fetus head, so here is the occipital bone, here is the frontal bone, anterior fontanelle, posterior fontanelle. So, you look at the occipital bone. If a occipital bone is toward the pubis, so it is the occiput interior. So if the occipital bone is toward the sacrum, it's a occiput posterior. The other are if it's a right side, it's a right occiput transverse. If it's toward the left, it's a left occiput transverse. So here are some other four important which are most commonly presented during the labor. So the right occiput interior and the left occiput interior, the right occiput posterior, and the left occiput posterior. So these are the important positions. So, but the most common is the left occiput interior, then the right occiput interior, then the right occiput posterior, then left occiput posterior. So these are positions. If you look at in this picture, you can see here. So this is left occiput, the interior. You can see the occipital bone. If it's toward the pubis side, so it's the interior. If it's toward the sacral side, like here, so it's a posterior. So if it's directly toward the sacrum, so that is the only occiput posterior, direct occiput posterior. If it's directly toward the pubis, so that is direct occiput interior. So and these are the transverse position, right and left. So these are the occiput interior, right and left, right and left. Okay. So these are the position. What is fetal lie? Fetal lie actually is the long axis of the fetus to the long axis of mother uterus. So it's going to be longitudinal, transverse, or oblique. Longitudinal is the normal one, or the which is usually in the cephalic. Okay, so here is the uterus. Here is the fetus. So if you compare their axis, so this is long axis of the uterus. This is long axis of the fetus. So both are same. So it's longitudinal and the lie. Okay, so this is the and this was the breech presentation. If you look at the cephalic presentation, so here is again the lie is longitudinal because the long axis is the same. Okay, so if you look at here, in this case, and this is the long axis of uterus, while the axis of fetus is like this, 90 degrees. So it's a transverse lie. Okay. So if you look at here, this is uterus lie, the axis, and this is the fetus axis. So the long axis is oblique. So it's a oblique lie. Okay. So there are three lie: longitudinal, transverse, or oblique. Okay. Fetal attitude, it's actually show the relation of bony parts of fetus to each other. Mean they show the bony parts are flexed or the extended. For example, in the vertex presentation, the fetal attitude is flexion. So mean all the body parts are the flexed. while in the the presentation, the all body parts are the fully extended. So in the military they are the moderate flexion, while in the bro there, and this is mid between the flexion and the extension. So if you look at here, so if you look at here, all the body parts are flexed. So head is flexed, the limbs are flexed. So during the vertex presentation, the attitude is the complete flexion. So while the moderate flexion you will see in the military presentation. Okay, so there is moderate flexion, while in the bro presentation there is midway, mean between the flexion and the extension. So some body part flexed, some are the extended. So while in the face presentation, so there is a full extension. So you can see head is flexed, limbs are flexed. So this is during the face presentation. Okay, so this show the attitude. Attitude mean they are flexed or they are extended. Okay. So what is fetal station? Fetal station actually show the descent of the fetus through the birth canal. So we check out by the checking the level of head of fetus relative to mother ischial spine. Okay, so we number them +1, +5, +4, +3, +2, 1, up to -5. So it actually shows the centimeter expiration, and I mean how a centimeter the fetus is above or below the ischial spine. If you look at here, here is the ischial spine. We consider it is a zero landmark. Okay, so above that the numbering is -1, -2, -3, -4, -5. It shows how much centimeter above the ischial spine. So it is in the menace, while if the fetus is crosses the ischial spine, then the numbering is +1, +2, +3, +4, +5. The number, each number shows the how much centimeter the fetus has descent. So at the 0, so we also consider it the engagement, mean the fetus has come from abdomen into the finally reach in the pelvis region. Okay, so this is engagement steps. Okay, during the labor, the that is an important term. So when there is the fetal station is 0. Okay, so these are the important terminologies. So this is summary of all the important terms. So thank you very much. Allah Hafiz.